with any organization is how fast can you deliver on your promises to an owner who needs the space. In our case, a medical facility is the largest piece of medical equipment the VA owns. A medical facility is the largest piece of medical equipment that the VA or any health organization owns. And consequently, we cannot deliver health care without it. So speed to delivery becomes really critical, and we don't do a good job of it, to be perfectly honest. So a part of what we were trying to do in our joint agency work is to figure out how we can eliminate some of the wasteful activities that occur between in the workflow that we have a responsibility for.
The United States government is probably the largest asset holder in the world. Bar none, any kind of facility that you ever wanted to see, the federal government owns it. And they have to manage it, and they have to build it. And that is the mission of what the Institute does. And that is to serve the nation in the public interest by supporting advances in building sciences and technology to improve the built environment. This project will do that. This project, for example, we just had this last January with our Academy of Healthcare Infrastructure, the largest healthcare owners across the country that are looking at ways to improve their delivery of services to the private sector. This is one methodology that they can employ.
If you think of this as Legos, you secure the data, then you create rules of how to get to that information, then you plug in applications on top of it. That's how a lot of these apps on the web actually work. You get a Yelp app with a mapping app, and you basically you're not troubled with having to understand the full complexity of the software in the background. You basically push buttons and you get to information. And that's the world that we already live in with our mobile devices. If we can bring our facilities into this, and SEPS2BIM is the result of that. So what I do is I put in my email address here, and down at the bottom it's listing the types of rooms. Now we also have static BIM or CAD type files that you can download, but those were built 6 months ago. So here we're not downloading a static file, we're actually requesting a dental examiner, which is DNT. If I hit proceed, now what this is doing is it's hitting multiple servers and saying what's the latest data about this, and it's going to send me an email. There it is, I got an email, it says your BIM file is ready. And you can try this, there's no login or anything, you can actually try this yourself. And it's building up the room on the fly, and you'll notice that this room actually has a layout, so the designer can now take those pieces and start working in their building information modeling tool. And you'll notice it has a date stamp on here. We put a fresh, like how fresh is this BIM, we called it, because it says it's 0 days old. It was created today. If I open this link a week from now, it's going to say it's 7 days old. Do you want to refresh it?
So the good news again is no permission is necessary from us to open the data. It's already there, ready to be used by anybody, including GSA. And it's that demand equation. So we've got the supply side going. Let's assume there are trickles of supply side going now. Now we need the demand side to pull more so that the federal government opens up even more than it has. And you guys probably saw about a week ago, the president, the White House released the new open source requirements, open for comment to say, okay, new code that's going to be developed, X percentage, I think it's 20%, must be all open source. So that's open data has always been around for about 5-6 years now. Open source is being tied to it. And if you guys can do a demand-based pull, I think it'll move faster.
Is that the technology is there. It's really an owner management problem in terms of defining how the management and the structure of these data systems works. We have many systems within all of our organizations, and invariably, either because of funding, budgets, organizational structures, we don't look at those systems as systems. We look at them as component pieces. From my perspective, when we get to this kind of paradigm that we've been describing here today, one of our biggest impediments in making it work is that we live in the past when it comes to how our organizations are structured. And it will only be when we change those structures to acknowledge the fact that we're living in a new paradigm and have to look in a different way at how we manage and respond to these data streams that we will be fully successful. Because if you don't, they can't work.